So you told us how you got into pharmacy and started your career. How did you develop from that point to becoming one of the top 50 most influential leaders in pharmacy?
Doesn't that blows my mind. It just really does. I still can't even believe that happened. You know, I think it was a series of events where I said yes to opportunity. And I really began to dig into my passion. And I think we all have this point. If it never happens and you never feel like I'm doing the wrong thing or I'm not fulfilled, that's great. That means you're on the right path. But I think a lot of us, especially in the healthcare profession right now, are recognizing that maybe we're not doing in my day-to-day work what I feel most passionate about or what is most helpful to the care of my patients. And as more and more healthcare providers struggle with burnout, I think figuring out new opportunities for you to say yes to that help you grow as an individual and help step into you contributing to what you're passionate about and helping that industry or that area or that aspect of patient care grow. That is really valuable for so many reasons, right? Because it can open different doors and opportunities for you to eventually make a full career shift, which is where I have now found myself. But I think saying yes to new opportunities can also breed a lot of self-content and is good food for the soul, I guess, so to speak. So I was working in a retail setting. So I was a community pharmacist. I was a pharmacy manager for Target, back when Target was Target Pharmacy.
Yeah.
And I loved it. I loved caring for my patients, but I knew I was probably destined for additional things. So I just started saying yes to opportunities. I started saying yes to becoming a trainer for the district. I said yes to speaking at local events, like for the Rotary Club or for the college, et cetera. And I just started taking chances to learn new skills, develop myself in new ways. And then I was offered a professor role because I had kind of differentiated myself in that sense. And even once I became a faculty member and a professor, I started saying yes to opportunities like, can you come do education on cannabis? I wasn't really an expert in cannabis, but I quickly became one, right? I started to learn a lot about it and said yes to the opportunity. Can you come do some consulting with us for the health department? Or can you help us manage our tuberculosis patients? I said yes to that, even though I wasn't a TB expert, but I developed that skill and that knowledge. And really saying yes to different opportunities is what got me involved in mobile integrated health when I was brought in to, provide some expertise on what medication challenges patients who are frequently calling 911 might have. And that was kind of the birth of how I got involved in mobile integrated health. So, and I don't know, Dr. Barchi, are you super familiar with MIH, or would it be beneficial if I do a quick recap?
Yeah, please give a recap, because I don't think a lot of people have heard about it or really know the impact that it can have. So yeah, please.
Yeah, absolutely. So when I say that I'm an MIH consultant or a community paramedicine consultant, that is an unusual term. So the concept of community paramedicine is basically, identifying the biggest healthcare needs in our communities, right? So we all know that there are communities with poor and underserved populations that don't have access to the healthcare that they need because they're either uninsured or underinsured. They can't navigate the healthcare system because there's a healthcare provider shortage, or because they have dementia or a substance use disorder, or whatever the issue is, right? So they can't access care that they need. They end up calling 911. They use the ER as their primary care. And we know that this results in two things. Number one, rising healthcare costs. The total cost of care per patient will go up. Number two, the actual disease control and health outcomes of that patient is not as good if there's no continuity of care. So what I do is I help to work with teams and local governments and associations and physician groups that want to take a healthcare team and then mobilize it to that community to eliminate all of those access to care issues and actually get that patient the resources that they need so that we can have improved health outcomes and reduction in healthcare costs. So mobile integrated health and community paramedicine are this concept of actually utilizing paramedics, taking them off an ambulance and putting them in an SUV or, another vehicle and mobilizing them into the community to help identify and resolve these issues. That's community paramedicine. And then mobile integrated health is taking those community paramedics and partnering them with a nurse practitioner, a social worker, a pharmacist, right? Or whatever other healthcare provider is necessary to resolve all of those complex issues that patient has going on.